Federal investment, $272 million, is meant to transform Alaska's rural health care. Reporter Joe Allgood joins me now. Joe, what are state officials saying in regard to some of the changes that we might see?
Well, they're hoping that this investment will completely transform Alaska's rural healthcare landscape, and they're hoping that will happen pretty soon. They're meeting this week in Anchorage with healthcare providers, tribal leaders, and community leaders to start to decide how to make those changes. Obviously, one of Alaska's biggest challenges is distance, and much of Alaska's healthcare is concentrated in urban areas. So the state wants to build out a larger network of services with a larger workforce.
So having a lot more opportunities to enter through apprenticeships or certifications for the entry-level workforce in healthcare, in addition to residency programs for physicians. We have a really small, narrow focus right now. We want to expand that. So looking at the full spectrum.
They also want to expand technological options for healthcare, like telehealth and wearable technology, smartwatches used to gather health data from those harder to reach places.
Well, it's all very interesting. Did they talk at all about maybe the cost of healthcare in rural Alaska and I don't know, how that might change now with the funding?
They did bring that up a little bit. They're talking about a value-based program rather than what is currently based in our healthcare system. They're hoping to prioritize the quality of healthcare rather than the quantity right now. So that system would look like bundled payments for patients rather than excessive procedures, which are less confusing and less costly as well.
We consistently see that people who live in rural areas, Alaska and beyond, have worse health outcomes with increased cost. And this is an opportunity to rethink the way that care is delivered to make sure no matter where you live, you have access to quality, timely, effective care.
Well, I imagine lower costs would be helpful. Do you know when we're going to start seeing some of this? When's it going to roll out?
They said that all depends on what they decide, but they're hoping that this funding starts rolling out in the next couple months.
All right. Joe Allgood reporting for us tonight. Thank you very much, Joe.